Ranjita, let me welcome you formally. So thank you for coming, joining our, group and giving your insights. You are somebody I really look up to because I know you are extremely not only congruent, but also somebody who really, no, you don't say you balance your life, right? What do you say? You maximize different domains of your life. So really nice. Ranjita is somebody who works, she organizes her work wonderfully. She does a lot of traveling. She does, I mean, she's amidst nature. She conducts a lot of sessions. She does physical, mental, I mean, very holistically, she leads her life. So she is definitely, I call her a very self-actualized person. I say you're right up on the top in the Maslow's hierarchy. So yeah, somebody who really, really is very disciplined and has a combination of everything in her life. So hats off to her for, and she's been doing it consistently for years together now. So with that informal introduction, Ranjita, over to you.
Thank you so much for inviting me, Seema, and thank you for that wonderful introduction. So mostly I will be talking about the practical aspects of this, both depression and eating disorder. So being a mental health first aid instructor, so I mainly help people who are going through different mental illnesses. So that is when Seema asked me if you can take a session on depression and eating disorder. So I'll share a few examples of what we actually practically that I worked with the clients. Of course, I'll be changing the names, but you will get the essence and what it is for a person who is going through depression and eating disorders. If you cannot see the screen, please let me know because I cannot see you also. That's the reason.
We can see your screen.
Yeah, okay. Okay, can you all see this painting?
Yes, Ranjita, we can.
Okay. So what do you feel when you see this painting?
The girl looks really sad.
Okay.
She looks bitter actually.
Any other thing?
Anger
looks
also.
determined.
She looks lost and disturbed.
Okay,
No, very determined. She's going somewhere very determined. Yeah.
Okay.
Focused.
Anything else?
Dog looks happy.
Yes, Vidya.
She looks focused and determined.
Or some kind of like I don't care attitude.
Yeah, very protective, I think, because a dog is behind her as well.
Okay. So this is actually a painting done by a person who is actually going through depression, where actually the person feels that anytime I can drown. So looking for hope, right? So I had few observations saying lost, or maybe the dog depicts there's somewhere looking for that, help or support from someone.
Hope, right?
There's another image. Yeah, hope, yes. Okay. So what do you see? Even this is a real image. Okay, the painting done by a person who is going
You're
through
seeing the
depression.
same image.
So what are some of the signs? Sorry?
You're seeing the same image. Okay, now it's there.
Even now?
Now it changed. Now it changed. Yeah.
Can you see now? Okay. Yeah.
Yeah.
Okay. So what do you see in this image?
Bird in a cage, trapped.
Yes. Very good observation.
All the emotions are depicted outside, I think, like she feels caged or there's danger around her. Or, everything looks barren, it's not green.
Gutted because her stomach is fully red and she's not able to express, like I guess that's gutted is what the word is. It's...
She seems to be in trouble.
Inside her, there's only one little spark left.
Sorry, I cannot hear Elizabeth.
She seems to be in
Okay,
trouble.
so trouble. Yes, so here Michelle actually is trying to feel that she's feeling dead inside, numbness, right? So she cannot look forward, or there is no hope. She is feeling totally numb. So the image is called as the death inside. Okay, I just wanted to share before we begin the topic. This is something that the person feels when he or she is depressed. Not sure why the screen is. Can you all see the next slide?
Not
No.
yet.
So Ranjita.
Okay, maybe.
Yeah.
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 You can see
Questions.
now.
Yeah.
Yeah,
I
these
think
are.
there's a small delay. Yeah.
Oh, okay. Yeah, so these are few of the questions which Seema shared it with me. So I'll be mostly covering only these topics. But if at all you think you have more questions, you can message me or call. I am happy to help and clarify. But since we have only 1 hour and to cover 2 topics, I've just limited to only these topics. So we'll be talking about the definition, the causes, symptoms, and the treatment. I'll not be going again deep into the treatment part, but I'll just mention you what are the interventions that can be used. All right. So what according to you is depression? So do you want it to be interactive, or you just want to listen first and then ask your questions?
Seema, what do you think is better?
Okay, Ranjita, then you decide in between, probably just to wake us up, some people who are sleeping. But yeah, I think you can go ahead with the session. And if we have something, we'll.
All right. Yeah, you can stop me in case if you have any questions.
Sure. Thank you.
Yeah. So depression is again it's also called as clinical depression or a depressive disorder. It's basically a mood disorder that causes distressing symptoms that affects how you feel, how you think, or handle basically any activities such as sleeping, eating, or working. But usually if you see, we use this term very loosely that I'm depressed all the time. But do you think they really are going through clinical depression?
No.
Do you
They
think
could
it's
be-
a clinical depression when you feel really upset?
No. Sad, being dull, frustrated, angry, everything we use as depression just because we're having a bad day.
Yes, exactly. So to be diagnosed with depression symptoms, it must be present most of the day, nearly every day for at least 2 weeks. So I'll share a few of the myths about depression, and I'll also share the example. Okay. So have you come across people telling he has become lazy, he or she, and he does not want to take responsibility? There was this client of mine, so who came, she had postpartum depression, okay? But her husband was not ready to agree. His only statement is, it's just that she don't want to do work at home. That is the reason that she is giving this excuse. She has all the comfort. I didn't tell her to work, but she just that she is not interested to do anything, and that is the reason she's complaining of all these things. Why I'm sharing this is it helps you to bring that awareness and also understand what it is, because we usually term he's always lazy or she's always lazy. So maybe it's very important for us to also watch that sign so that we just don't pass that comment, right? And also control your thoughts and you will be okay. Don't just sit around doing nothing. A few of other statements that, or the myth that we actually hear is, I think this is very common, that antidepressants are addictive and should never be taken. And that's the reason that many a times it stops people from taking medication or treatment. So they don't seek help because they think that antidepressants can actually be harmful and addictive. But if you actually see, it is same with the physical illness. We all have, I'm not saying here that there are no side effects, but still if it is actually taken in the prescribed way, So it can actually do more good to you than bad, right? So people usually say this, they are taken only by people with weak minds or those who are bad. Or I have more tension and yet I'm not depressed. How can he act so silly? I think even this statement we hear often, where people telling that I have more problems than him, and look at my life, what all happened, and still I'm able to manage. It is just that he or she is very weak, or just giving an excuse for not doing anything, or doing it for attention seeking or for sympathy. So unfortunately, many people continue to suffer for long periods of time or even lifelong just because of these myths, and they are not seeking help. So there is a tremendous need to motivate the person to seek help. It's not that, okay, now that I understand, or I tell the person to seek help, they will be ready to it. So the psychoeducation plays a very important role, where you make the person aware and make the person understand about the benefit of taking this medication. So sometimes making his loved ones understand that he needs help is even more difficult. So the follow-up, or consistently not giving up, or telling and helping the person can also help the person in recovery. And again, one more thing to note here is, it's not mandatory that all depression, it's based on the low risk or medium or high risk that the medication is required. At times, even with just counseling or like CBT can also help in the recovery journey. So to broadly classify depression, there are two things, that is, it can be endogenous or exogenous. So endogenous, as the name says, it's something more to do about how the person feels within himself or herself, right? And exogenous being reactive, that is, it can make the world seem dark and sad because of what's happening around rather than what is happening within or inside. So for example, endogenous depression, here it could be because of the family history or genetics. And for exogenous, it could be because of sudden losing of a job or getting divorced, breakup, grief. It could be anything of that sort, which is mostly external. Okay. So here we see a common few types of depression. That is, one is major depressive disorder. We will be seeing the symptoms in the following slide. So if the symptoms persist for more than 2 weeks, and that is one of the sign or the symptoms where you have to actually consult a doctor. It can be GP, psychologist, or a psychiatrist, where they will be able to diagnose if it is really a depressive symptoms, or it is just a phase where the person individual is feeling low. The second one being where there's the presence of psychosis along with depressive symptoms. That is like he or she can have hallucination or false beliefs, right, or perception. The next one is seasonal affective disorder. This is not something that is very common we see in India, but especially in where there are there is episodes that occur usually in winter months. I think even when we see for a week no sunlight and it's raining, we kind of feel very dull. But again, that does not qualify that, or we cannot say that I have a disorder here, right? People with this disorder will need certain type of light therapy or exposure therapy, which can help them in recovery. The next one being persistent depressive disorder. It is also called as dysthymia, where symptoms present on most days over a 2-year period. So the next one is premenstrual disorder. That is significant mood symptoms that occur during the menstrual phase. And the last one being postpartum depression, occurs shortly after childbirth, or also it can actually happen during this pregnancy as well. So we also have heard about bipolar disorder. I'll not be going in detail because this was not something that was there in the question which Seema shared. So here, individuals who are diagnosed with bipolar disorder, earlier it was called as manic depression. So they will have an episode of the depressive, they can have a normal state, and also the manic. So basically actually the diagnosis takes a long period of time, because to tell that the person has bipolar disorder, at least minimum of 1 episode of mania has to be there. Only then we call it as a bipolar disorder. It can be like a depressive state and then mania. So it's if there's a straight line, so the graph, so depression and then mania, again it can be a low phase, normal, again depressive. So it is like that. But at least to say it is a bipolar disorder, 1 episode of mania has to be there. So again, this is, I've already discussed this, I'll not be going in detail, where what are the symptoms usually interferes with their ability to work, sleep, study. Whereas in persistent depressive disorder, it is actually it will last for at least 2 years. A person diagnosed with this form of depression may have episodes of major depression along with periods of less severe symptoms. It's not that always they will be in that low phase. So it can reduce the symptoms and then again they can fall back. I think we have already discussed this in detail, so I'll just skip this slide. Okay, so the next comes the causes of depression. So it could be, there are various causes. So the one being the life events, where it could be the childhood physical abuse, sexual abuse, bereavement, neglect, or mental abuse, and personality, changes in personality or also in one's social environment. It could be even the bullying, where the actions of someone commenting or passing any comments or physically or socially harming or abusing, right? And also alcoholism, where initially people might think it can act as a depressant, but slowly what happens is that it slows down some of the regions of the brain. So it will do more damage than helping. So this is a negative coping mechanism that people use when they feel low. So it can also be because of physical illness, where you have certain infectious disease or a nutritional deficiency or any other physiological problems. And it can also be side effects of medications that you're taking for your physical illness, or it could be any other medication. It can also be for your mental illness as well. The other cause is the substance use, that is several drugs of abuse can cause depression, whether in intoxication, withdrawal, and from also chronic use. Any questions?
Oh, Ranjita, it's quite
Or
clear.
can we move on?
Yeah, please move on.
Okay. So when we talk about family history, we have already mentioned if a parent or a close relative, or it could also be genetics. But when I say personality, it could also be worrying a lot or having low self-esteem. So even that can cause, or being a perfectionist or sensitive to criticism, that when someone says that maybe you're too fat, or you're obese, you're short, you are dark. So just to share an example here, so there's a client, okay, let's say Mira, okay. So what happened was she is 16, she is South Indian, okay, she's British. So but they are actually in Delhi. So what happened to this child is that when they were playing, usually she was isolated always. They were passing comments because of her color. And she was always told that don't involve, and she was not involved in any of the group activities. And one time this was happening, and she was still trying to manage. She used to talk to her mother, and she used to make her, accept herself. It's okay, we love you, and all those things. But at that age, it was very difficult for her to digest. But there was one trigger. What happened is that when there was one group activity where they all had to stand in a circle, so they had to hold hands. So one of the girl passed a comment that I don't want to stand next to her, because if I touch her, even I might get that color. So this has had so much of damage, and it was so traumatic for her that she couldn't take it. So I don't want to stand near her. So she's still taking treatment. She's still, I'm, coming for the emotional counseling part. And she slowly fell into depression, even though she has family support. Even her parents love her, and she's going for therapy, counseling, and all that. But still, that she cannot forget what has happened. So she feels that she's ugly, and she stopped eating. She started using mobile, and she can't take, even when she posts something on Insta, if someone dislikes or if someone comments something negative that you're not looking good, it affects her, and she stops eating and she cuts herself. So she has that non-suicidal self-injury. She started cutting herself, and now she has suicidal thoughts, and she wants to attempt suicide. So when I talk to her, so what she's telling, so she wants to kill herself, but something she says that, but I feel bad, that what will happen to my mother and father, because they love me and I know that, but that is the only thing that stops her from acting upon that thought. So this is the damage that can do. So this is something external. It was not something because of she had in a family history or something, but this is something that has happened because of someone telling, bullying or criticism. Right, so her self-esteem is very low, so she'll not even come out of the room. So now slowly she's actually started walking. She's taking, because there's no enough sunlight, which makes her feel even more worse. So not exposed to outdoors, no fresh air, not opening the window. She just wants to sit inside the room, switching off all the lights. She wants it to be dark. So that is something about personality. And serious medical illness, that is the stress and worry of coping with serious illness. Even that can cause depression, something, a long-term illness, or like cancer, or any kind of, because where there's the treatment is a long-term, can also cause depression. The drug and alcohol use, I think, which we have already discussed, it can be initially to explore, we might, people might get into this, but if it becomes a habit, or if they use this for a coping mechanism, even that can lead to self-harm or death. So these are some of the common symptoms of depression. So how do we identify? If someone is experiencing 5 or more of these following symptoms for more than 2 weeks, it may indicate a depressive disorder.
Of self-worth, loss interest, insomnia, digestive problem, physical.
Meda, are you talking to me? Do you have any questions?
No, Ranjita, sorry.
Okay, yeah, okay. So, but one thing to remember is, even though these are the indicators of depressive disorder, there are also cases that maybe they might have only 2 of these symptoms, but still can have depression. That's something that we need to remember. So just to mention a few, like if you're feeling sad, guilty, or helpless, and reduced sense of self-worth, right? Even the self-image issue, or if you don't feel worthy, so even that can cause depression. Or loss of interest in activities, insomnia or excessive sleeping, trouble focusing and making decisions, changes in weight or appetite, physical pains, like if you see children who constantly complain, or in teenage, where they have stomach pain, or even headache in adults, digestive problems, restlessness, pessimism, always thinking negative, or black and white thinking, right? Irritability, and also suicidal thoughts or attempts. Again, it's not that people whoever go through depression will have suicidal thoughts, but if not treated, or if not gone for counseling or therapy, it can lead to suicidal attempts. So again, I've just mentioned it here. So I think we have covered most of it: difficulty in concentration, or fatigue, tiring quickly, and feeling a lack of energy throughout the day. Feeling guilty and blaming yourself for past failures, or feeling unworthy, and lack of interest in sex or sexual activity as compared to previous levels of interest, and thoughts about self-harm and suicide or death. So I've just classified into behavioral feelings and thought at thought level. So where behavior could be that the person, how do you identify the person not going out anymore or not getting things done at work or school, withdrawing from close family and friends, relying on alcohol or sedatives, not doing usual enjoyable activities, unable to concentrate. So this is something that you can see at behavioral level. And feelings could be like overwhelmed, guilty for mistakes, or irritable, frustrated, lack of confidence, unhappy, disappointed, sad. And thoughts could be that I am a failure, or it's all my fault. Nothing good ever like happens to me. We spoke about pessimism, right? I'm worthless. So it is usually when the person feels, it starts with feeling helplessness and then worthlessness. And it is that when the person don't see any hope, like if you remember that first image that I showed you, where the person is thinking anytime the person can drown, that was the feeling the person, that's what the picture depicts, right? So that is when the person actually thinks of ending his or her life, where people can make a statement also. It's not just at the thought level. People might say certain comments like, I don't think it will affect anyone if I'm not there. People would be better off without me. These are certain things that people, they are strong indicators where you know that even though at times we might, not all the time, we might ignore saying that the person just needs attention. That is the reason he or she is doing that. But it can be a strong indicator that the person is going through depression or has some suicidal thoughts. So usually they give indicators. It is that sometimes we might miss out on identifying that. And at the physical level, they feel tired all the time, or the immunity that goes down, so they might fall sick very often. They might have physical like headaches, muscle pain, sleep problems, and significant weight loss or gain. So what do you think? Does depression looks the same in everyone? Now that we have discussed general signs and symptoms, do you think it is the same all age groups, or it's with everyone the same thing or same sign that we see? What do you think?
I think like every other disorder or emotional state, it's different for everybody. It will not look the same.
Absolutely, yes, right, Geeta. So it could be, it might vary from, again, in children also it might vary, but usually in younger children, we see this irritability or clinginess or refusing to go to school because they are bullied, or probably, they might complain of stomach ache or stomach pain. And in teens, it could be also along with this. So certain symptoms are common across all age groups, but it can also, they might also use like recreational drugs or alcohol, sleeping too much or too little, and they start with self-harm and all these things. So these are certain signs in teens. And also something that we forget is in older adults and people, they are very reluctant to seek help. So they might face memory difficulties or personality changes. Again, physical aches and pain, which we have already discussed, and about fatigue, loss of appetite, and often wanting to stay at home rather than going out to socialize or doing new things. It could also be because of loss of partner or retirement. These are some of the things that can also, they might, because all these days they felt that they are very important or they are contributing, and suddenly they feel now I'm dependent on my children. These are certain things that can actually stop them from socializing, and they can slip into depression. And also the illnesses, right? So certain effective interventions for depression is CBT, interpersonal therapy, and these are some of the psychological therapies, even mindfulness based therapy. I'll give you an example for mindfulness-based therapy. There was this client who met with a fatal accident and was physically disabled. All right. But now the person is slowly started walking. Of course, it's a few years now. But what happens is that when you work on like being in the present, when they're able to identify their thoughts and emotions, what they are feeling. So being mindful of now. And along with exercise and of course medication, it is helping her in her recovery journey. So that is where we don't see or hear it often. And also I think in your syllabus, it's mainly the CBT and psychodynamic, I think, approaches that I saw in that question. So let's not go very much in detail to that other therapies, and lifestyle and complementary therapies that, like exercise, light therapy, which I mentioned for seasonal affective disorder, and yoga, which can help them so that, it can slowly, but it's again, not as easy as what we tell, go exercise, do some work. It really, when they have these symptoms, even to get up and brush or take shower, it is so difficult for the person who is going through it. And of course, medical treatment when the person is going through major depression or severe depression. And there are other treatments like ECT, TMS, and antidepressants that are given, which helps them in the recovery. So we'll not be, Seema will not be going in detail with CBT and things which you told that you will be discussing. I think someone else will be talking about this. So I'll not be going
Right.
this.
Right, Ranjita, yeah.
So, and again, there is also people think if someone goes through bereavement, it means that they are in depression, right? So even though the death of a loved one or a loss of job or ending in a relationship are difficult experiences for a person, it is normal to feel sad, right? When you lose a person who is your very close one. But it need not be that they are going through depression. Okay, so being sad is not same as having depression. The grieving process is natural and unique to each individual and share some of the same features. So there is an overlap. So that is the reason we get confused. So both grief and depression may involve intense sadness and withdrawal from usual activities. But if you actually see the person who is going through, grief, they can also be optimistic. At times they might think of all the positive things or, about the person that they loved or something. But whereas in depression, it's an episode of like where you're continuously feeling low all the time. So you don't think of positive. It is more of a pessimistic attitude. Right. So in grief, painful feelings comes in waves, often intermixed. There is a positive memories as well there. Right. So, but whereas in major depression, they always, mostly it is low. So, and again in grief, not necessary that their self-esteem has to be low, but whereas in depression, it's mostly that their self-esteem is low and they might not feel worthy of living. These are certain, that is the difference. So for some people, the death of a loved one can bring also major depression. That is also possible, but not necessary. It happens in every cases, right? So when grief and depression coexist, then the grief is more severe and lasts longer than grief without depression. So once we are able to distinguish between them, we can give the right treatment and support. So what are some of the benefits of early intervention is lower risk of relapse, less stressful assessment and treatment, reduced need for hospitalization. When I talk about hospitalization, it could be because of self-harm, you cut yourself, or there's an infection or a suicidal attempt, reduced family disruption and distress, and improved recovery, and better attitudes to treatment, and reduced risk of suicide. So this is something that I want to ask you all, if you're aware of people taking antidepressants when they go through depression. So for some, depression medication causes an increase rather than a decrease in depression and suicidal thoughts and feelings. So because of this risk, FDA advises that anyone taking antidepressants should be watched for increases in suicidal thoughts and behavior. So why do you think? Actually, if you take antidepressant, ideally it has to reduce the symptoms, right? So why do you think it can actually increase the suicidal thoughts? Especially it is greatest during the first 2 months of antidepressant treatment. Why do you think that?
Maybe some side effects which might affect self-personality or self-concept.
Okay, so one could be side effects, yeah, for which we can actually talk to the doctor. They might change the combination of it. Anything else that you can think
Yeah,
of?
I think originally when you're depressed, I'm having suicidal thoughts, but I don't have the energy to work on it. I'm lazy to even suicide. But antidepressant lifts my spirits, gives me some energy, and the first thing that goes to is the suicidal thought that I have in my head, and it gives me the motivation to, conduct suicide.
Yes,
That's what I'm.
hang on, Sunita. This is the first
So-
time I got this answer in any of my training session. I've been taking so many sessions. That's right. It's basically when you're in that feeling or when you're in the depressive mood, it is that you don't even have that energy to act upon your thoughts. But it is what happens is that when even parents, because there is no awareness, when they start taking treatment, not many are aware. They think that, okay, my son is doing well, my daughter is doing well. So there is no attention given. So that is why the chances are high that in first 2 months of taking antidepressants, they can actually, it's not again for all, it is the chances are high that that they can act upon that thoughts. Why I've mentioned this in the slide is, so like maybe I think it was 4 years back. So there was this client. So this a child who was going through depression. So later he had this suicidal thoughts, and he actually drank some pesticide. So he was hospitalized, and then slowly he started recovering, and he was also under this antidepressants. He was taking medication, and slowly he started doing better, and he started going to school. So parents were very happy that, okay, he is now recovered and he is doing well. But something that unfortunate that happened was, I think maybe after 1 week or something, because he skipped school for so long. Suddenly, maybe it could be because someone passed comment or whatever the reason is, he actually hanged himself. Okay, he died, and just after 10 days, when parents are already grieving the loss of the first child, the second child also died of suicide. He started feeling guilty, but the attention was all and the focus was about the first son. He started feeling guilty that they were sharing the room, they were staying together. So that is something that can happen. So again, there was so much attention that was given to the son who was going through depression. The second child started feeling ignored, started feeling guilty, that why am I normal but not my brother? So that is the reason I'm mentioning this here. So it's very important that if someone is going through depression and if they are on medication, it's very important for a caregiver actually to specially, monitor or observe if they see some changes.
I just want to add something here.
Yes,
and most importantly, if there has been any suicide in the family, whether in our immediate family, sibling, or even uncle, auntie, far family, it doesn't really matter. If the child or anybody who is mentally a bit weak, and if the child or teenager especially, if they're aware of the incident, they are especially more susceptible to suicide in the future when they are having difficult times, because suicide is a very impactful thing for somebody's mind. And whenever there is a weakness, immediately the mind throws up this incident of suicide. So even if they didn't see the suicide or the body or anything, but in your family, if you keep on discussing about what happened to a far off uncle and why that child suicided, it is actually impacting the thoughts of the people in the house. So that is important to refrain from having those kind of thoughts and conversations.
Yeah, I totally agree. My sister's classmate, her very good friend, in fact, my sister's friend. So her uncle had died of suicide. So we knew this when we were in school. Okay, this happened when we were in school. I was in primary and my sister was in high school. So, this friend of hers was actually talking about it. You know, this happened in my family and all those things. And it came in newspaper and everything. It's a small place. I'm from town in Sulya. It belongs to Mangalore district. So we kept on hearing about this and all those things. So even though she used to talk about how can he do all these things, probably there was a lot of conversation that was happening. It was her mother's brother. And in 2015, she was working. This happened when she was in high school. In 2015, one day my mother called just to tell, when we were in shock, in fact. She just told that she's no more. And we were like, suddenly what happened? then that is when we got to know that even she died of suicide. Maybe she was going through something which no one knew, but again, I feel that there was some impact that happened in her childhood or in that school time when she was a teen. Probably when she was going through certain problems or difficulties in life, maybe that is the first thought that came into her mind and she actually acted upon that thought. Thank you for sharing that, Sunita. So usually the crisis associated with depression or the person, that's an emergency situation where, someone can have a suicidal thoughts and behaviors, or the person can engage in non-suicidal self-injury, like how I spoke about that Mira's case where she was cutting herself. Whenever someone tells her something, the first thing that she'll come home and do is to cut herself. Okay, with this, I think we have completed suicide, and also I've shared these examples of Mira about how she has that self-image issue because people told her she's dark and we don't want to even touch her. And I also discussed about the physical disability. And initially I spoke about the postpartum depression where the husband is in denial. Again, here she had symptoms where she actually, in fact, she used to come and cry, and she used to, with every statement, she used to cry and she used to tell that I just want to kill all my children. So she has 3 children. She's like, I don't want them. I don't like them. And we see that very often even in newspaper, where we see that mother killed the child. And we think that how can mother be so horrible? It is actually that chances are high that they are going through some it could be postpartum depression or any major disorder that can actually make them do that, right? There is so much of imbalance that can cause. So this is about the Zoya, the postpartum depression. And I also spoke about this brothers, right, who actually died of suicide. So any question on depression? So with this, I think we have completed with depression. So if any questions, we can cover it here, or I'll start with eating disorder.
I have a question.
Yes, sir.
Can you talk about masked depression? Depression wherein the symptoms are completely absent and it feels almost like euphoria, that the person is engaging a lot more with the world, probably trying to get attention on social media and behaving in a manner that is usually not aligned with depression.
Yes, even this is possible. There was one case, I think it was in 2017, I'm not very sure. So again, even the extreme behaviors. So it is usually even in the manic stage, right? Mania, when we're talking about it. So where actually the person walked, this person was from Andhra Pradesh somewhere. So he walked, even he was married. Okay, so where he actually went to some other place, he's not even aware of what he's doing in that state. He went to another city, he met a lady, he married that person. Okay, and then after some time, he realized that, okay, I'm married already, right? Then when they filed a missing complaint, they kind of figured that he's in some other place, and they got him. And another one, when Ishwar spoke about this, there is something called copycat suicide as well, or the cluster, where this happened in Chennai in 2018, where there was series of suicide in one institution where the person jumped from top of the building and died. And similar cases were observed in the next couple of months where people use the same means, the students, to die. So there was total of 5 or 4 cases of suicide there, right? So sometimes it can be extreme that is the reason I told, even though these are some of the common symptoms, sometimes the person might not show any of these symptoms, or it could be also that very reactive, like I failed in exam, so I don't want to face my parents, or sudden job loss or death of someone. So we see, right, suddenly they're so dependent on some person. So there was no trigger. Basically, maybe the person had low self-esteem, but maybe did not fall under this depressive or diagnosed as clinical depression, but can still actually, they can take that impulsive decision and they die. So there are different cases, not just what Ishwar said. So these are copycat suicide, or in the mania stage bipolar disorder, or without any signs, or just, just want to be happy before I die. So people don't even have any signs, but still I would like to highlight here something, that there are certain signs. It is just that because the person looks happy, we might ignore that sign. The people can be very good at masking as well. So that is something that we can't just go by, okay, the DSM or ICD, we just follow this, that if this person has 5 symptoms, then only we are diagnosing him as clinical depression. The person can have different other symptoms and still fall under this category. Any other questions? Did that answer your question, sir?
Hello.
Yes, sir.
Yeah, I have a question. So is there a possibility?
One second, Satya.
Sorry.
Before we go to the next question, I was just thinking about the mask depression. I'm just regarding that, see, when somebody is over a long period of time is depressed, all right, but they have developed a personality without, like masking is nothing, but sometimes we mask by intentionally, but over a long period of time, people tend to, as a response to traumatic incidents, or as a response to, or a coping mechanism, people develop masking personalities. So they grow up thinking, I am this outgoing and extroverted person whom everybody will love. That kind of personality is developed by this person, but the depression is underlying, is on the inside. So that, sometimes I believe that the person itself is not aware that they are depressed. Okay, so for example, like even in the case where she was talking about the color, or being very fat and being bullied and all that, first you start feeling, as a child or as a teenager, they might be feeling very sad and upset and depressed about the way they're being treated by the skin color or their fatness or whatever it is, and they used to feel so hurt. It becomes so traumatic that internally flip switches, and they start actually making fun of themselves before somebody else makes fun of them. So basically they're brushing off the pain that would they will get when somebody else says it. So instead of somebody says, oh, you own a black dress, now we don't know the difference between your face and the dress, and before somebody else says, that person itself will say, today I chose to match my skin color with my dress, and they all laugh. They also laugh and make other people laugh. Then this becomes a pattern, and they start developing a humorous personality, extroverted personality, which would impress other people, as well as take their attention off these shortcomings which the person feels on the inside, thereby not going into that feeling of pain. But just because they laughed it off, or just because they deflected it, it does not mean it doesn't hurt them. Internally, it would have hurt them. Internally, it is building up, and they are being depressed on the inside. So mask depression is basically on the outside, they appear like this, but actually we need to go inside and see their personal lives, how they are living their personal lives. We will see a drastic or a contrast between how they appear on the outside and how they are living their personal life in the thing. That's when you will understand that the person is actually depressed. They might be in their life, they might be living in outside they'll be perfectionists, the house will be in shambles. Outside they will be very organized, but the house, they will not eat properly, they'll not sleep properly, they will not wash clothes for days. So that kind of thing will be there, which only close family members and people will understand. But usually in our society, they start making, they start scolding that person itself, saying that you're putting up such a big scene on the outside, but you're a worthless person, because in the house you're not worth, you don't do anything. What is the use of you being such a big shot outside? In the house you don't know even to fold clothes. So these kind of statements they'll be hearing in the house, which will again keep adding to their depression. So mass depression, and one day when they finally take some kind of a trigger and they take a drastic step, that is when it comes to light that they have depression. That's my take on mass depression.
Thank you so much, Sunita. Maybe I'll just add on a few things. So just to how I came to this field is because I went through clinical depression. So something very similar to what Sunita shared was, I was very good at work. No one can even, I got good promotion and everything. But when I come back home, it's only that, the people at home, they can identify those signs. I was very good at masking. It became a habit for me because it went on for many years. So I'll be in that low phase and then I go to that normal state. Okay, I'm managing somehow. But slowly it will decline, your productivity and quality. But no one got to know. By the time I felt, okay, this is a time for me to resign. So people always had a very good picture. No one will believe that I had that when I was working. Okay, so why? For me, again, the sign was something because something happened. So when I was 18, I was physically assaulted by a stranger when I was walking on the road, because of which I had a spinal cord injury and I couldn't go to college. And for some time, even though I finished later my master's and everything, but at that age, for me, my self-esteem affected a lot. So initially it was like, I cannot stand straight, I'm bending, I was disabled, I couldn't move. So all these many factors that led to my depression. But initially I didn't know, I did not have that awareness too. But again, my father is a doctor, so he kind of identified the signs, and I was under medication for some time at that age, and then I recovered. But still, again, after started going to college, because of I used to suddenly collapse and fall down because of the injury. So I felt so ashamed, like I'm not normal like others, I'm not good enough, so I cannot play like others. All these things actually led to depression. So it was like, for me, cyclical. At some time, like I just don't want anything. So I was very good at masking. Outside people, even my best friends will not know. So I'm very good at masking. So something very similar to what Sunita shared. But it's the pain, like what the caregivers go through, right? It's very difficult because they don't understand. Outside you're so fine, so why are you doing this? Are you doing it for attention seeking? Because there is no awareness about this. So then it was very difficult even after my marriage. So it went on for many years to identify, then recover. But now it's that more than 7 years that I'm like recovered, and I'm doing. That is the reason I quit corporate and I'm into this mental health training, because I know how it feels to be depressed. Because in that so many years, I have even attempted suicide. I had this suicidal thoughts, but again, masked all the time. I'm always a smiling person. So outside people never know that this is something that was happening inside me. I will close the door. I will not eat. I will not talk to anyone. I'll not open the door. I'll just go out of the home without telling anyone. I just want to sit alone somewhere. So that is what something that happens. So practically, I'm just telling what goes inside. And again, it could be different. This is my experience. So each one will go through it differently, then, because the event or the situation might be different for them. But still, with the support, I could recover. And from last 7 years, I have no issues, or there are no suicidal thoughts or anything. So life has been amazing, and I'm helping through these trainings or something, whatever I do. I think it is giving me more satisfaction and fulfillment. So just wanted to add to what Sunita shared. Yes, Satya, you had some question.
Yeah, so I just wanted to understand, is there like possible for a person to feel depressive only towards certain aspect of life and feel like literally okay in certain aspects towards life in a day? I'm not telling about the maniac and those kind of, not in a long duration. Is it really possible, like for them to go ahead with their physical, like say the normal routine and stuffs, but still feel depressed towards certain aspects of life?
Initially, these could be the signs. Again, we cannot, because it's a case by case, right? I cannot say, I want to know the person. Is it something that they are feeling from long time? But slowly it starts affecting other areas of life. Even though right now, maybe the person is doing well in certain areas, but not able to manage in relationship, or there are some conflicts or certain activities they enjoy. Maybe it's a very low risk. With support, they can maybe bounce back.
Okay.
But it is when it is like, throughout the day, not able to even get up from the bed. But people think that it is that they are being lazy. So that is when it is a problem, and it takes longer time. If there is no intervention, it takes longer time to recover for that person. So just, it could be also that the person is not interested in such activity and certain activities. That's the reason he or she might not be doing that. So we cannot just label the person with certain, okay, this symptoms I think even I have, so I think, am I depressed? So these are certain things that comes to our mind. But again, it has to be over a period of time that you feel the same thing and you don't feel happy at all. It's a continuous thing. It's not that one day I feel good, one day I feel bad, right? So that is something that you need to keep in mind.
Okay, good.
Thanks so much, yeah, Ranjita. It's really nice of you. And just one last bit I wanted to ask you, that does that person who's depressed be able to cognitively think of, masking, and when I go to office, I will not let everybody know? Does that person have that ability?
See, here they have not lost in touch with the reality. Like how in schizophrenia or any psychotic symptoms where they lose in touch with reality. Here there is helplessness, hopelessness. Again, it depends. If it is like a psychotic depressive, maybe not. But here I was aware that something is happening, but I didn't know it was depression or a mental illness. There was no awareness. I'm talking about like when I was 18, like it's many years ago. So more than 18, 19 years. So it was at that point of time. So I could still think, but somewhere I started realizing when my pain started increasing, there was psychosomatic also. Along with my injury pain, I also had all the time I'll have migraine. I want to eat tablets. Those are all my coping mechanisms. Right? So I was aware something was happening. So maybe I didn't want to show because it's like an image that you're forming at office. I did not think with respect to, okay, is it that I'm masking, not masking? But with outside people, I was always good. But one thing, there was again an indicator. I was always crying. Anything people pass a small comment, I will cry because my self-esteem was low. That was an indicator, but again, they are also not educated and aware of it, right? Like my classmates or someone who bullied or, name calling me Ajji or something because I bend and walk. Right. So I was not doing it. Maybe I want to show in front of them that I'm normal. At that point of time, that is my mindset. So
including Ranjita, including very high demanding jobs like a chartered accountant or a doctor also, when they can go about their day-to-day job, even though they are depressed, right? That is possible because we have a lot of counselees sharing that, during that time I was in a depressed state. And I used to wonder, how do they go about, especially a chartered accountant working from 9 in the morning to midnight, 12 or something, how do they do it? So they are able to deal with it along with their depression.
Slowly, the productivity goes down. Because when it is not managed at all. So if I'm like doing some activities which makes me happy, probably I can bounce back or it's still in that state. But I'm not taking care of it and attention at all over a period of time, maybe years also, maybe 4 or 5 years I still work, but still I'm in that same loop, right? So that can happen. I thought I'll just clear the depression question. So before we move on to eating, so I can just conclude with this.
Yeah, go ahead with the eating disorder. Are you fine? I mean, last 1 hour you've been talking so much.
No problem.
Okay.
So we have 25 minutes. I'll just take the last 25 minutes for this and any questions on this topic.
Sure.
Okay. So what is eating disorder? So it's something that is, as the name suggests, serious conditions related to persistent eating behaviors that negatively impact our health, our emotions, and our ability to function in important areas of our life. So have you come across anyone who is going through this, or someone in your family or distant relative, friends, or you have heard about it?
I know of people who normally eat more, I think. So not sure.
Yeah, that's the reason I asked, because I think it was last month, one of the parents, so she told me that my daughter is eating too much. I think she has eating disorder. Right? That is when she's my student. So I was just talking to her. What I understood from her, it was not the eating disorder that she had. It's basically that was her coping mechanism, because she felt that her mother was busy taking care of this child's grandmother. She was ill. So she was not getting any attention, no one to talk to, because mother was all the time busy taking care of her mother. So that is when she told that nobody talks to me. No one is there with me at home. I feel so low. So I find happiness when I eat. So she used to eat a lot, but it was not, the reason was not because she thought about herself that she looked thin, fat, or anything like that. It was mostly her coping mechanism to, you know, for a loneliness. So again, it is not right to label, just like depression or any other disorders, right? We kind of label, okay, he's eating too much, I think he or she has eating disorder. So let us see in detail, like what actually happens with them, right? So most eating disorders involve focusing too much on their weight, body shape, or food, leading to dangerous eating behaviors. So basically, these behaviors can impact their body's ability to get appropriate nutrition by eating too little or eating junk food or unhealthy food. So what happens in long run? Eating disorders can actually harm heart, digestive system, bones, teeth, mouth. It might be surprising why teeth, because when they actually vomit, the acidity can actually cause decaying of the tooth, and it may lead to even other diseases, even the skin, the dryness of the skin and other things, right? So it usually, disorders often develop in the teen and young adult years, but although they can even develop at other stages, like binge eating can even, we usually see it in the mid-age as well. So with treatment, we can return to healthier eating habits and sometimes reverse the serious complication caused by this. So there are like the DSM. So they've classified into mainly these 4 categories, that is anorexia, bulimia, binge eating disorder, and other eating disorders. Since in your topic, I think I saw only the first 3, so I'll be talking mostly about those 3 things. So let us see this AN. Okay, it is potentially a life-threatening eating disorder. So characterized by an abnormally low body weight. So basically here they think that they are fat. Even though because of not eating, they are thin, they still cannot believe that, they still think that I am fat. That's a common statement that you hear. I'll also share one client, I'll share that story with you. So basically they have the distorted perception about their body weight and shape. So people with anorexia use extreme efforts to control their weight. They might stop eating, or they don't eat at all. They secretly might tell people, lie that, okay, I had my food, but in actual, they actually skip their meals. So this actually interferes with their health and life activities. So when you have anorexia, you excessively limit calories or use other methods to lose weight, such as excessive exercise. That is another thing. Using laxatives or any other diet aids, vomiting after eating. They'll eat and then vomit forcefully, right? Efforts to reduce their weight or even underweight can cause severe health problems. Sometimes, sometimes to the point of starvation. It can cause to death. The next one is bulimia nervosa. So here it is also called as Diana syndrome, because even she had this, right? So it is again a serious, potentially life-threatening disorder. But this is something, if you compare anorexia and bulimia, this is something that we often see, right? So when you have bulimia, you have episodes of binging and purging that involve feeling lack of control over your eating. You think that you cannot control. Okay, so they might restrict eating during the day and then eat in the night, and eating all sort of junk foods. Then they start feeling guilt and ashamed, or they might feel that I have gained weight. So what they do is forcefully vomit, right? Or they might exercise too much, or they might use any other laxatives or any other methods to remove the food from their body. Okay, so basically they have this body image, or they think that I am not perfect, I am not beautiful, I am obese, I am fat, these kind of things. The difference here is there you're not eating food, but in BN, it is that you eat and then you start feeling guilty and you might vomit. The next one is binge eating disorder. So this is mostly even in middle-aged people. Actually, it's not just with the teens that they regularly eat too much food and feel a lack of control over their eating. They think that they cannot control, and even if they are full, sometimes eating also full can cause so much pain to them, but they still binge eat, right? So even though they know this is my capacity, they kind of eat more till they are uncomfortably full. So after a binge, they might feel guilty or disgusted, but the difference here between ANBN and BED is that here, even though they are ashamed there, but still they will not do anything about too much about their weight, right? And here they might not be very thin. Either they can be obese because of this binge eating or their normal weight. But whereas in AN, what happens is because they are not eating anything, they become so thin. It can lead to this malnourishment, and they can even die because of that. So there are other eating disorder like rumination disorder, where this is also seen in certain people with the intellectual disability, where the person regurgitates the food, right? And then they chew it, swallow it, or they spit it out. Another one is avoidant or restrictive food intake disorder, where the person, avoids such color or texture, smell, or certain taste. They avoid certain food with the sensory characteristics. And they are so concerned about that consequences of eating that, such as fear or choking. So basically, food they avoid, fear of gaining weight. And the last one here, have you come across people who eat chalk or paper? Have you come across people like that?
Yes, actually, I have a friend, but she eats ice also, and she loves chalk.
Yeah, and that is also people who eat ice. Again, they think they're eating too much, but again, there is no nutrition in it.
Yes.
Right? Yes, so that is, I'll not be going deep into this. Okay. So yeah, this we have already discussed about different types of eating disorder. And again, binge eating is mostly seen like highest in male, but also it happens with female. Whereas in AN and BN, it is mostly in women that we see, because they have that self-image. Someone criticizes, you don't look beautiful, you're thin, fat. So it's mostly we see that in female. Okay, so what are the signs of eating disorder? So when it comes to emotional and behavior, usually they're almost preoccupied with the thought of gaining weight, and am I eating too much of carbohydrates? I don't want to eat dairy products, or they avoid certain kind of food, right? So and they're uncomfortable in eating in front of others. What if they criticize me? These are some of the emotional and behavioral aspects. Okay, or they might suddenly stop eating certain kind of food, or totally stop eating, starving, withdrawal from friends and activities because they don't want to eat in front of others. What if others might judge me? If I eat too much, they might think this is why you're fat. It could be various reasons. And they frequently diet and overly concerned about their body size and image. If you see what happens with these people, like for example, we see people relate success to when they achieve something in work, career related. Maybe I got promotion. They might link that success to that. But what happens here with the eating disorder is that people think if they are in certain shape or size, only then I am good enough. That is the reason that they start doing this. Extreme mood swings. These are certain emotional and behavioral behaviors. Okay. Then other physical warning signs are weight loss or weight fluctuation, sensitivity to the cold or feeling cold most of the times, even in warm temperature, and changes in or loss of menstrual patterns. Some people stop menstruating, and swelling around the cheeks or jaw, calluses on neck, knuckles. You can make out, right? What happens when we don't eat, or if there is no food, malnutrition, right? Or dental discoloration from vomiting, or they frequently faint and fall down. And these are certain warning signs, so that we identify that something is indicators that something is wrong with this person. And certain psychological warning signs are, which we have discussed certain things, but I'll read out few, that extreme body dissatisfaction, distorted body image, like constantly complaining. Even though you tell them you look good or you are fine, they don't agree with you. They feel that no, you are simply telling it to make me happy. I know I am fat, I should not be eating this. They start feeling guilty. Then they eat junk food like fries or these kind of things, and then they again feel guilty about it. It's like a cycle for them, right? And their anxiety level increases during meal time when they have to eat food. And they might also have this eating disorder, like co-occurrence with depression and anxiety. Then it can lead to, or it can worsen the situation. They'll usually have low self-esteem because of this body image. And also they can have black and white thinking, labeling that this is good, this is bad, or even if we give compliments, they might not take it. These are certain warning signs. So what are the causes? Okay, even though still there is a lot of research going on, they say that it could be that certain people might be, they are into this eating disorder, could be because of genetics and biology. And other things, as I mentioned about self-image, like if we can take that case of Mira, she is not eating food because of self-image issue, okay? And she thinks it's not. So there is a combination. So she has depression, plus also she is very conscious. I will not tell that she has an eating disorder, but she's very cautious because people might tell something for that as well. These are certain things that constantly runs in our mind. Again, like depression, it could be because of family history, someone is obese, or they constantly talk about diet, or even when parents criticize, you look so fat, you look like a pig, or these kind of comments also can make them feel that I'm not good or I'm not good looking, which can in turn, they start with dieting, which can lead to eating disorder. And starvation and also stress can also lead to eating disorder. Okay, so again, certain treatments, right? So for usually there is no proper, there is no one treatment for anorexia. As you saw the signs and symptoms here, the person is already so weak. So the person might have to admit in the hospital till the physical health stabilizes. And then the family therapy can help the person, because where the parents are encouraged, or even they are educated and told that, monitor how, about their child, about how much they eat nutritious food, and preventing them from severe dieting or over exercising. At times, what happens with the combination of depression and eating disorder, sometimes we miss out on the signs. For depression, people say you have to exercise, but they might do over exercising because they have eating disorder as well. So that can actually harm them more. So it has to be monitored, not to over exercise. And for bulimia and binge eating disorder, CBT is the best treatment, where it aims to change eating habits and weight control behaviors, as the person is continuously thinking about his body shape and weight. And other than that, even certain other treatments are found to be helpful, like antidepressant and self-help books. Again, when I say self-help books, where under the guidance of a health practitioner, where you are reading books which actually gives you or that awareness. Let me tell you an example. So there was this girl who was 17 years who had this AM. Okay, so she did not, even though she was aware slowly with therapy and counseling, she was not still willing to. She felt that, no, I still look bad or fat. So with her, okay, this self-help book actually helped. So one day, even though she saw her mother is crying and father is criticizing that you look like a skeleton, you're so thin, she wanted to change, but she couldn't. she felt so helpless. And in her case, it was that book actually that helped her, where she saw certain images of a person and how that person died because of this eating disorder. She started working, and it was difficult. It was not easy. Again, for her, family therapy was used, where she was helped by her mother to, and another, apart from reading books, another thing what she told was, she saw her younger sister seeing in the mirror, okay, one day, and she started telling that I look so fat. So that is something that actually realized that how her sister is also role modeling her, and she is actually doing everything what her sister is doing. Then slowly with the help, and it took 2 years for her to work on this, and slowly she recovered. So it is possible with the right help and therapy, it is possible to recover. But not many cases that I see, but still it is there. That is something that I want to tell, because people say in India, we don't see that there is already malnutrition, because of which that we cannot consider as eating disorder, but there are people who do it, right? That is why we see this therapy that helps the people, but not many cases that I've come across. And again, in crisis associated with the eating disorder is a medical emergency. Now, how will you know that the person is experiencing something? So certain indicators are either due to malnutrition, they may faint and fall, they can have organ failure or electrolyte imbalance, bleeding in their digestive tract. So these are all certain indicators for us. So we know that there is something, that there is an emergency. So medical emergencies required here. And also at times they can, if it is a co-occurrence with other symptoms, so they can have distorted thinking, like psychotic symptoms like delusions, hallucination, disorientation, like not knowing what day it is, what's happening. We saw that psychotic symptoms. They are vomiting. Again, it's not because of food poisoning we are talking about, because of binge eating or throwing up several times a day, collapsing, or being too weak to walk also. So, and other things like cold body temperature, irregular heartbeat are certain crises associated with eating disorder. Other than that, there are people who think also, if it is co-occurrence with depression, it can also lead to suicide or self-harm. Any questions on this so far? Or even on depression, not just this topic. So
yeah, I had a question, Ranjita.
yes,
I don't know, in one of the previous slides where you said one of the symptoms was feeling cold. Does that work the other way also, feeling hot? Or is it just only cold?
It is mostly cold and low body temperature. They usually tell them, because they are not eating anything, so the body is not able to take, so there's no enough food. So how do we generate heat in the body?
With food, yeah.
Food, right? So it's mostly the cold or low body temperature is something that we see.
Okay.
Ranjita, in the causes of eating disorder, we talked about genetics and biology, change in brain chemicals. How does that person come by change in brain chemicals?
Yeah, when I say genetics or biology, so even I mentioned, right, when they have intellectual disability, or if it is something genetically that they have certain issue.
Change in brain chemicals, for any example?
I have not come across any like a practical case, but as in depression, where, for example, why do we take antidepressants or something? It changes our brain chemicals, right? So that we can function better.
Basically, your serotonin, dopamine, and everything.
Serotonin, yes, the brain chemicals. So that is.
Okay. So yeah. Ranjita, so is it can be like hormonal changes also we can think as a changes in brain chemicals?
Yeah, it's only, as she mentioned, it's mostly with the serotonin, because we use antidepressants for that specifically. But as I mentioned, when it comes to eating disorder, right, I've already mentioned here, it's mostly the person needs that education, that why that self-image issue has to be removed here, more than the medication that we give here. Of course, we are working on stabilizing their physical health, nutritious food and all that thing. But it's not that we use antidepressants all the time here. It's only when there is a combination of this to feel good hormone, because they might also be feeling worthless, right? When they have this body image issue. So that is when we use this so that they can start feeling better. But again, here the combination of treatment is required. It's not like only one therapy. It's like a collaborative care that we use.
Hello.
Yes, Satya.
Yeah, I just want to add, like I just came across a video wherein they were mentioning like a coexistence of this eating disorder with personality disorders.
Yes,
like say the obsession, like say the obsession or the obsessive compulsive. So that like it's an obsession to stay thin and slim, right? So generally when it, in the case of anorexia, they kind of check it for OCPD. And in the case of bulimia, they check for like the borderline personality, where they have the impulse, like they have the impulse issues. They can't really control themselves. So I think there is a link, like as you said, along with depression.
Yes, Satya, I totally agree. And I think even that will be covered when Sridhar will be talking about personality disorder. Again, OCD is different from OCPD, so which you will be learning in personality disorder as well. Right? So again, even there we tell that he has OCD just because he washes hands. So there's lots. I think it's very difficult to cover everything in 1 hour, especially 2 topics. But I think it's almost 8:27. We have 3 more minutes. If any question or any feedback for me?
Fantastic
It
session.
was a great session,
Superb.
Ranjita.
I think you got everybody's attention. Just amazing. Very nice.